We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for health system CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now.
Hello, and welcome to the Health System CXO Podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. I'm Jackie Kimmell, Senior Director of Member Insights at the Health Management Academy, and Strategy Executives host, sharing the latest market trends and essential insights happening across healthcare so that you can chart a strategic path forward for your health system and move quickly and expertly in the right direction. Today we're going to talk about a topic that has been very presently on my mind over the course of the last 6 months in particular, which is Medicare Advantage, or MA. My team has been researching Medicare Advantage since probably about September of 2023. And over the course of the last 6 months in particular, I have given presentations on Medicare Advantage to many of our forums at the Health Management Academy, including our CFOs, CSOs, CPEs, VPs of finance, rev cycle leaders, as well as many industry leaders. And they have been some of the most interesting talks I've given over the course of my time at the Academy because this is such a hot button issue today. Many health system executives are very concerned about what is happening with Medicare Advantage and with the market today. And so I want to spend a little bit of time in this podcast today walking through the MA market, making sure I'm giving a bit of landscape over why so many health system executives are so anxious about Medicare Advantage, and share a little bit about what I've heard behind the scenes of what leaders are thinking around Medicare Advantage, where there's agreement and where there's disagreement. And then in a following podcast, I'm going to dive a little bit deeper into what I expect of the health system and payer market around Medicare Advantage over the course of the next 6 to 12 months and give you an idea of what to expect moving forward around MA. So, you too can be as informed as possible on this really hot button issue. So with that, let's go ahead and dive in. Now, MA, or Medicare Advantage, has been around quite a while, and it's, kind of always been in the background. But as the program has grown over the course of the last few years, it started to really bubble up as a major topic of conversation. We have gotten to the point where at the start of 2023, we were seeing over 5% of the entire federal budget, so not just healthcare, being devoted to Medicare Advantage. This is equivalent to about 1.5% plus of total GDP being spent on MA. So it's a huge sector of the economy, and it's one that many would say has been somewhat overripe for regulations. The major reason that so many are, really homing in on MA as a spot for regulatory action is just how much money it has made the major payers over the course of the last few years. If you look at a graph, you'll see that MA has grown pretty consistently over 6% year over year over the course of the last few years, and it grew particularly quickly from the pandemic up through 2023. Now, the reason it grew so quickly is because 2 things. First of all, payers wanted it to grow. Many of the largest healthcare companies like United Healthcare, Humana, and CVS Aetna have been putting tons of money behind brokers' incentives to push MA and putting out those little tents that you might have seen across your grocery stores or CVS to try and sign up patients for MA. The reason why is it makes them a whole lot of money. In general, MA profit margins are twice as high as any other insurance product that they would have, to the point that they're making just around $1,800 per MA patient per year. So very high profit margins for them, especially when you start to think of millions of people being on these programs for them. As a result of this, they have really shifted their businesses to prioritize MA. I'll tell you one stat that I think shows this quite clearly. So in 2023, 46% of all of United Healthcare's revenue came from Medicare Advantage, even though MA members were just 15% of their members. So that huge delta between 46% of overall revenue and very similar profit with 15% of members kind of tells you everything you need to know about how much United Healthcare has prioritized Medicare Advantage. Now, why have patients been willing to sign up for Medicare Advantage? Well, that's because of a couple of factors. First of all, there are a whole lot of Medicare Advantage plans that are available to beneficiaries, 43 on average in 2023, which is double the number that existed just a couple of years ago in 2018. Most of those plans have no or low premiums. So 66% have absolutely no premium beyond what they have to pay for Part B. And for those that do, the average is $18.50. So not very high when you're comparing them to what many, traditional Medicare beneficiaries will buy, which is a Medicare supplemental plan to kind of make up the difference of spending that they are having for their health care. And then, of course, you have huge availability of supplemental benefits. So things like vision, which is offered for 99% of MA plans, hearing, which is offered, and hearing benefits, I should say, which are offered for 98% of plans, fitness benefits offered for 98% of plans, dental for 97% of plans. You get the picture. A whole lot of supplemental benefits offered to these MA beneficiaries. And so if I am an older adult trying to pick this out, I have kind of the labyrinthine, confusing traditional fee-for-service Medicare where I have to buy a supplemental plan, or I have this Medicare Advantage that is being marketed at me where I often don't have to pay as much and I get these great supplemental benefits and I have so many options in my market. Unfortunately, many of those MA plans have a lot of kind of hidden downsides that are not always marketed to members, which are things like, they might have strict controls over prior authorizations, over referrals, over which doctors I can see if I'm an older adult, but I may not know that when I sign up for those plans. This is kind of a problem because if you look in mass, what you start to see is that the patients that have signed up for MA tend to do so primarily for economic reasons. And you start to see that compared to Medicare fee-for-service beneficiaries, MA beneficiaries are more likely to be low income, have lower levels of education, be Black or Hispanic, and reside in urban areas. It's also meant that there is a huge variation county to county on how much uptake there is of the MA program. So even though over 50% of the country as a whole is on MA, for those eligible, of course, what you see is that, there's some states like Wyoming, where only 11% of beneficiaries are on MA. And then there's some states like Alabama, Michigan, and Hawaii, where penetration is over 60%. And this, of course, goes down to a county by county level, where if you look at Florida, you might see Miami-Dade, which has over 80% penetration, but then look, a couple of counties over and see Key West, where there's just 20% penetration. So huge variations market to market. All of that means, just to recap a little bit, that payers are making a whole lot of money for Medicare Advantage, more than any other business line. They've shifted a lot of their business to be focused on Medicare Advantage, with payers like Humana basically dropping everything else that they were doing to solely focus on Medicare Advantage. and that they, are really dependent on a market by market basis of where Medicare Advantage has high penetration and where it doesn't have high penetration. The problem for many payers is that they have started to see their margins decline. From 2019 to 2022, they saw a 1.5% decline in profit margins. And actually, this was before things got somewhat bad for them. So over the course of the last 6 months in particular, there have been all of these changes that have been rolled out for payers that has made MA less profitable. So you'll often hear V28 or version 28, which was a new model that was rolled out by Centers for Medicare and Medicaid, CMS, which essentially crunched down the number of codes, the ICD-10 codes that were eligible for reimbursement, and really tried to target the codes that were being overused or upcoded in MA to cut down on over-reimbursement, which, was set to, and it's phased in over time, but overall, have a negative 30% impact on plans' overall revenue over the course of the next 6 years or so on a per year basis. You've also had a lot of other changes, like changes to star ratings, these RADV audits that are trying to claw back overpayments, and then CMS has continued to slightly chip away at the overall rate that it's paying MA plans, reducing it by about 0.16% in 2025, which, overall, they're still projecting a increase in revenue due to the fact that the population is growing sicker, but they are continuing to reduce the rate that they're paying MA plans. But that's not it. It's not just regulatory. You've also seen payers be hit with a lot of other headwinds. They have seen more outpatient procedures than they were expecting. They've seen more hospitalization than they were expecting, partially due to some changes in the 2-midnight rule. And they've also been seeing patients just kind of generally be sicker than they were expecting. They've also just had a kind of a bizarre failure to forecast seasonality and these trends like the flu season and, what they're expecting over the course of 2024. And so as a result, a lot of payers have been pretty beat up due to Medicare Advantage in the public markets over the course of the last couple of months. You've seen Humana have a 40% decrease in their net income Q1 2024 as opposed to Q1 2023. Their share price at one point had dropped over 40%, and they only got a third of the people to sign up for MA that they were hoping would sign up for MA. So a lot of payers just very much struggling over the course of the last few months with Medicare Advantage. Now, what do they do when they are struggling in this way due to all of these headwinds? Well, one thing they're doing is, some of them are trying to drop particular markets, cut down on the benefits they're offering beneficiaries. But that means that they're going to lose out to their competitors. So say Humana drops a market, maybe United picks that up, and then they'll gain, even more share than they have of the market, gaining probably up to a third of the total market by next year. So, they can do some of that, but they're still going to be losing out to their competitors. What is the other thing they can do? Well, they can increase friction with the providers that they are contracted with and with the patients that already have Medicare Advantage. Now, what does friction mean? Well, these MA payers are very intentional to actually price some degree of friction into these MA plans. Everything that we just talked about, of all of the great things that they can offer beneficiaries through MA, things like those vision and hearing benefits, etc., as well as the fact that premiums are so much lower, is due to the fact that they expect that beneficiaries are going to have a couple of challenges actually either taking advantage of those benefits. There's some recent research that finds that really a surprisingly low number of beneficiaries actually do take advantage of those benefits, but also to take advantage of the care that is even in network for them. So, actually getting that referral to go see a doctor is harder than they expect. Maybe their doctor is out of network, or maybe they need to get a prior authorization for imaging or for a surgery, for instance, that they need, and that can often take far longer than they expect. All of that friction is often being placed on the doorstep of leading health system and other health system executives. So on the health system side, you have many health systems that have contracted with multiple MA plans, most of them because they were able to get over 100% of Medicare fee-for-service rates for those MA patients. So they figured, why not? This is a great windfall for our system. However, as they've seen more and more of that friction be introduced into plans, they've seen a huge growth in a number of things like prior authorizations, claims denials, and audits. And all of that is pretty disastrous in terms of the money that health system executives expect to be paid for those services that they're offering. So for instance, health systems have seen a 63% growth in MA denials as a percent of net patient revenue from January 2022 to July 2023. And all of those things that I just talked about, those claims denials, prior auths, audits, etc., drive down what they expect to make on Medicare Advantage patients far below, what they had expected. That number is called their yield. And so what you tend to see is the yield on MA contracts for leading health systems has dropped below the 100% that they were expecting to 90% on average last year, and now as low as 85% on average for leading health systems. I share this number because this is really the crucial number to know of why health systems care about Medicare Advantage. It's what are they getting as a yield on their MA contracts. And many of the health systems, when I've kind of polled the room and had people raise their hands, depending on where their yield is today, have said that their yield is around that 85%, 90% numbers, with some dropping as low as 75 to 80%. That is a major challenge because health system margins have been so much lower than even the pandemic, with many operating on a razor's edge. And so when you start to talk about maybe half of their patients having a yield, being on contracts with a yield of 85 to 90%, you start to see how many are not getting the money that they are promised, and that has a huge implication on overall revenue and overall health system margins. And so with that, I am going to pause for this episode. I hope this was a helpful background on the Medicare Advantage landscape. There's a whole lot more I can talk about. In fact, I have a deck of probably 41 or so slides that I can use to explain this market. And I think we just talked through, maybe 3 or 4 of them. But what I want to do in the next episode is talk through a little bit more about what health system executives have said about this market, how they are trying to respond, and then what you should be watching over the course of the next, say, 6-12 months in terms of how the MA market will change. And, if you're going to be reading the tea leaves, what you should know about MA as a smart healthcare executive. So thanks for listening. Bye. Thank you for joining me on the Health System CXO Podcast, where we activate health system leaders towards outcomes and scalable solutions you can implement now. Remember to subscribe to the Health System CXO Podcast on your favorite podcast platform so that you never miss an opportunity for insights. If you liked this episode, consider leaving us a review and sharing our podcast with your friends and colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.